You know, refugees, we like to call them people on the move, are not just fleeing war, climate crisis, and collapse. They're navigating systems that often perpetuate harm. This can be prolonged asylum processes, chronic uncertainty, bureaucratic forms of dehumanization. And in far too many settings, mental health remains an afterthought, sidelined, by humanitarian responses that prioritize survival over restoration. And I want to just zoom in on a powerful counterexample, which comes from one of our partners, AMNA. They're formerly the Refugee Trauma Initiative. So in northern Greece, their Baitna centers, meaning our home in Arabic, create healing, cultural grounded spaces for refugee children and caregivers. And, what's important to understand is that these aren't medicalized clinics. They're no white coats. Instead, trained community facilitators, many of them displaced themselves, offer storytelling and music and play and consistent presence. And I remember hearing about a group of young Syrian boys who arrived at one of the centers, and they were really silent and withdrawn. And over time, through this relational engagement and these tools, they really began to play again. They were smiling and speaking and laughing. And, that transformation was the product of trust and safety and belonging. And we need to recognize this for what it is, expertise, this lived experience, this relational intelligence and cultural fluency. And if we're committed to building systems that support refugee well-being, we have to center these forms of knowledge, not just as supplemental, but really as foundational.